Hello friends, I am Dr. Nitesh Karnire, consultant cardiologist. So today I am going to speak about a very important and a neglected topic, that is hypertension. So before I start, let me tell you all what is hypertension. Hypertension is increased in blood pressure. Whenever the blood pressure is more than 140 by 80, it is called as hypertension. So why more than 140 by 80? Whenever the blood pressure is less than 140 by 80, all the organs are well given all the blood supply. But when it is more than 140 by 80, the pressure increases and this can damage the organ. So what all organs it can damage? So let's start with the brain. Increased blood pressure can cause rupture of the arteries in the brain. This can cause bleeding inside the brain, which can be fatal. Also, increased blood pressure can cause clot formation and blockages in the brain vessels, and this can lead to stroke. So coming to heart, whenever the blood pressure increases, the pressure inside the heart increases. This will lead to increase in size of the heart, and this can affect the pumping in the heart, and the pumping capacity of the heart comes down. Along with that, it can also cause blockage in the heart, which can cause heart attack at a later stage. Now, along with the brain and the heart, it also affects the kidney. So, in the kidney, it affects the cells, that is the nephrons, and this will damage the kidney, and when the damage goes on for a very long time, it can cause permanent and irreversible damage to the kidney, and the kidney function can be affected, which can later lead to dialysis of the patient. So coming to symptoms, majority of the patients with hypertension do not have any symptoms. It is find out on just checking the blood pressure routinely by some other doctor for some other reason. Suppose the patient with blood pressure, he will not have any symptoms. He just goes to a doctor for fever, and while checking blood pressure, his blood pressure might be high, or the patient might have gone for a general health checkup, and that time the blood pressure can be picked up. Majority of the patients will not have any symptoms, so we have to be very careful and check our blood pressure regularly. Along with that, some patients might have recurrent headaches, giddiness, which can cause which might be the symptoms of blood pressure, which can be diagnosed. So now coming to the treatment of blood pressure. So in this treatment, most important thing what we have to do is we have to find out who has blood pressure. So regular health checkup should be done after age of 40. Get your blood pressure checked regularly. If you have a family history of blood pressure, get your blood pressure checked regularly. And just some camps will be organized. That time also get your blood pressure checked regularly. So along with get diagnosis of blood pressure, other important thing is that take the medications regularly. Once you're diagnosed with blood pressure, take the medicines on time as advised by your doctor, and take it regularly. Do not skip even a single day. This will help in preventing the damage that causes to the organs. Along with that, adequate diet and lifestyle is very important. Diet rich in fruits and dietary fibers and nuts, and increase water around 2 to 3 liters per day is going to help in preventing the blood pressure. Also, along with that, exercise is very important. Moderate intensity exercise should be done by every healthy people for about 4 to 5 days in a week, and about in each day approximately 30 minutes to 1 hour of moderate exercise should be done by every patient. By normal patients to prevent blood pressure, and patients who have blood pressure, this will help in reducing the blood pressure. So what exercise can we do? So exercise like jogging, running, swimming, playing cricket, tennis, any sport whichever you like, that you can do, and it all helps in reducing the blood pressure. Most important along with that is avoid stress. Have a stressful life, do some yoga, meditation, some hobbies which will help in preventing the stress should be done. And most important is the sleep. Sleep is very important. Adequate sleep is must to control your blood pressure. Before ending, I would like to inform everyone about the myths about hypertension. Many people have a myth that if I take the tablets regularly, this BP tablets can affect the kidney. No, it is not like that. If we do not take tablets, the blood pressure increases, and when the blood pressure increases, this increased blood pressure will damage the kidney. So whenever you have hypertension, always see to it that blood pressure tablets are taken regularly and your blood pressure is always under control. This will help in preventing any kidney damages.